Good afternoon, everybody, and thank you to ISNTD for this opportunity to share our work. I'll just keep you for a few more minutes before lunchtime. My name is Andy Gibson, and I work for the NGO Mission Rabies. I'm a veterinarian and a researcher, predominantly looking at the problem of rabies and rabies control. So rabies is obviously an NTD that doesn't often crop up in water conferences, but I have come to the right one, and this presentation is about our collaboration with a water-focused NGO called ISNTD. So just to touch on One Health, and the reason I'm really passionate about this particular project is that I feel it really is a true demonstration of One Health. And people talk about cross-sectoral, multidisciplinary and collaborative approaches, and this is a kind of slightly out there, off-the-wall idea that really is making a difference. So on the front of rabies, we're looking at this pathogen of the rabies virus, obviously, which is transmitted by dog bites from infected dogs to people. And our collaborators from ISNTD are focused on boreholes, and obviously that's also in itself a One Health intervention, helping livestock, agriculture and people. So the problem of rabies in Malawi, which is the focus of our project, costs an estimated $13 million per year to the Malawian economy through human deaths, post-exposure prophylaxis in hospitals and livestock losses. We estimate that it kills around 586 people every year, but far more people are exposed. An estimated 20,000 people are bitten by rabid dogs every year, and they're saved from contracting the disease from post-exposure prophylaxis. Access to clean water is also a huge problem, particularly in rural areas of Malawi, where an estimated 30% of the population don't have access to clean water. And that obviously, as we've heard this morning, comes with all of its morbidity and mortality problems. So we're working in a similar area to our partner organisation and really looking at how can we join forces in these regions to have maximum impact. Mission Rabies are focused on mass dog vaccination to vaccinate over 70% of the dog population. We also go into schools and communities to teach people about how to avoid dog bites and what to do if they do get bitten. And finally, we develop effective rabies surveillance strategies to help governments implement effective surveillance to monitor the impact of their ongoing control efforts. Our partner organisation, ISNTD, are very much focused on improving access to clean water, so through assessing boreholes and repairing broken boreholes, through wash activities and monitoring pathogens in those water sources. We work in the South Malawi here in 3 districts called Chirizulu, Zomba and Blantyre district. So if we zoom in a bit closer, these are those 3 districts, and the dark areas here are the urban centres, so Blantyre city in the south and Zomba city in the north. And we have an office in Blantyre city and another office out of Zomba city. ISNTD are based in a rural area down in Ntonde EPA. So Mission Rabies previously were working across these 3 districts, and ISNTD focused purely in the southern region there. And because we're going across these 3 areas, we said, well, we can use the resources that we have to also contribute to their data and help them expand their work also. The team structure is very simple, really. It's not a complicated process. In our teams, we have community educators who go out into communities first. They intimate the village headmen and go into schools and teach the children and tell them that we're coming to vaccinate their area in the next few days. Then we have our dog vaccination coordinators who link in with government workers to vaccinate dogs in those areas. And that's it for Mission Rabies side of things. Then on ISNTD side, they're conducting surveys of boreholes where they're sending teams out to GPS tag and record where boreholes are and what their state of repair is. And then also repair teams who go out to try and repair those broken boreholes and bring clean water back to those people who depend on those boreholes. And looking at our 2 project structures, we found that there was some give in our community educators and their time that they're in the field, and they can actually do some of the work of these survey staff. So in the areas where we're going and doing our vaccination work, our community educators can go and also record information about boreholes and their state of repair. And so it's this linking up of resources and saving and efficiencies. We've developed a smartphone app similar to the systems that Andrew was talking about earlier. Primarily, this was developed to gather data about our mass vaccination efforts. And going one step further than just being a data collection platform, we actually now use it to structure our project and our campaigns. So we actually now use it also to direct the teams to new areas. So we can review the area they vaccinated and then feed back and actually tell the teams where we want them to go next. So we're recording our dog vaccinations. We record surveys of coverage assessment after we vaccinated an area. And we're also, our education teams are recording information about the schools they've taught in and the people they've educated. So the surveyors are just doing these bottom two activities on the app. From the Madzi Lippo side of things, those educators also then record the GPS location, the time and date that they visited those boreholes, the community contacts who are responsible for looking after that borehole, that water source, and the type of borehole, so whether it's an open water source, a well, or some kind of borehole. So our teams are then not only recording information about the people they've educated, but also is information about the water sources. And finally about the functional status, so whether it needs repairing or servicing, or whether it's completely non-functional. We feed that data then back to Madzi Lippo, and they can send up follow-up teams of specialist people to actually go and further assess those boreholes. They immediately have the GPS and the contact person of who's responsible for that borehole, so they can quickly go to that area and quickly do the work that they need to do and gather more information. So the smartphone interface is very simple. We can create customized forms and customized questions. So when they're in the field, they again offline enter the data about those boreholes, the community members, and then once they've got a connection, they load that up to the cloud-based server. So similar to what Andrew was talking about earlier. And so here they are. This is our initial training effort where they're testing some boreholes and assessing them. And this is the kind of data that we get through from the back end. So we can map out all of these boreholes across this region, as well as their state of repair. In total, this year, we've recorded 603 boreholes were surveyed. The majority of them were AfroDev type boreholes, with a lower proportion of people using rivers and wells as their water source. And we can also see the state of repair. So 29% were in working order. Quite a high proportion, about a third, were in need of servicing, so the flow of water was reduced and they had significant problems that needed servicing. And then about 11% were not working and 2% needed to be condemned altogether. So these pictures just give an example of the kind of things that they would go out and record when they're in the field, going to these villages, vaccinating dogs anyway. They'd find the water source in those villages and record it on the smartphone app. So this was the data of the schools they visited. They recorded all the schools that they went to. In total, over 120 schools and educating over 100,000 children. And this was the comparable borehole data that they collected at the same time. So we can see here that the majority of boreholes in the Blantyre area were in working order. But in the Chirizulu area, which is this region, there were a higher proportion that were in need of servicing. So that's where Madzi Lippo then sent their teams to go and service those boreholes and help those communities. And so what this really comes down to is the sharing of resource and improvement in efficiencies. When our teams are going out doing these public health rabies interventions, a high proportion of our costs is in the vehicle maintenance, the vehicle costs, and getting those staff to these remote villages. And so if we can link on other useful activities for them to be doing at the same time and bringing in funding for those activities to help fund the overall project, then that's really beneficial for our rabies campaign. So in the rural areas, the total cost per dog vaccinated was around $5, which is much higher than in the cities where it's only around $3. And so Madzi Lippo, through their funding, are helping to fund those staff salaries to go out and do this survey work as well. So it's in that One Health context, it's really helping to achieve more with the limited resources that we have. That's all I've got to say. It's a very, very simple project, but if you've got any questions, I'll be happy to answer them in the break. Thank you.